pill has been around since 1960, and it's just one of many birth control methods that are available. Here to talk about the different contraception products and some of the benefits and the risks with each, please welcome Dr. Marjorie Dixon. Hi, Doc. This is a great topic. And it's good actually to get a bit of a refresher because there are new products all the time in the market or things that have evolved a bit. So let's talk first of all just about contraception in general.
Yeah, so contra, against, conception. So there are ways of preventing getting pregnant. And usually people in their brains, they kind of organizing it into barrier. So sperm hits a wall, doesn't get to get in.
Yeah.
And then there's the hormonal. Sometimes it's combinations of them.
Yeah.
So if we're thinking about barrier contraception, the one that everybody knows is
condoms.
Condoms, yeah.
Yeah.
So there are male condoms, there are female condoms. If you are only you need to use barrier to not get sexually transmitted infection. So I have to use that as a PSA.
Okay.
Now that there's contraception and hormonal contraception where you don't ovulate, so the barrier ones prevent the sperm from hitting and then prevent infection from getting inside.
So the barrier ones are going to prevent both pregnancy and the transmission of STIs or STDs.
Correct.
Okay, so that's good to put in there because just because you're on a hormonal contraceptive doesn't mean you're barring yourself against disease.
Absolutely, and that's what I find with the younger women when I talk to, because I do a lot of public speaking, and the younger women now entering into the sexual fold know about the HPV vaccine, but they know about the condoms, but sometimes they're like, well, I've been in a relationship for about a year, so I think it's okay. I'm like,
no,
it really isn't. There's a bit of a judgment in there, but that's a whole
other segment. Okay.
And then
so
the other barrier one is diaphragms. So the diaphragm is essentially a little, you fit it up against your cervix, and then that prevents, and well, sometimes some of the infections, but mainly it prevents the sperm from getting to the eggs.
Okay,
so those are barrier.
Do people are still using diaphragms?
Not so much. No.
Okay, because
really
it feels like old school.
Yeah.
Okay.
It is older.
Yeah.
But then when you're thinking about hormonal, so how hormonal contraception works, it prevents ovulation. So the estrogen part of the hormonal contraception prevents you from ovulating.
Got it.
And then the progesterone component of the hormonal contraception actually makes your uterus a not happy place for an embryo to grow. So it's an inhospitable environment.
Got it.
It also makes your cervical mucus sticky, so it acts as somewhat tough where the sperm gets there and gets stuck. So in the second half of your cycle, the first half of your cycle, you know, it's estrogen rich, where you get really kind of slippy and you're about to ovulate. That's estrogen effect. And then the progesterone, when you get moody and randy and it's not a happy place for embryos to grow. So those effects of birth control pills, they can also come in patches. They can also come in intrauterine devices, so IUDs that people talk about. The old IUDs were just, they would create sort of a barrier in an inhospitable environment as well.
Okay.
But now there are also hormonal secreting intrauterine devices.
Okay,
so those are, because of the hormonal component, they prevent ovulation and make the land barren. So you're less likely to get pregnant. Do some people get pregnant on the birth control pill? Yes, they do, but for a variety of reasons. Now, there are also non-contraceptive benefits to birth control pills.
Yes,
or to hormonal contraception. So those are the ones that I find I have interesting conversations with people about all the time, because people are not necessarily aware of it. So, for example, when patients come into the office, sometimes I have someone say, I know I have a small fibroid and I'm going to need to have my fibroid taken out surgically or even my uterus out. Doctors always look for ways of avoiding surgery. I mean, I love to cut the people open to fix them. Like, I have no issue with that.
You're such a doctor. But you're going to try and go through
the first person to fix people surgically. However, we do try to avoid surgery because there are risks associated with surgery, the anesthesia, the complications, infection, bleeding, whatever.
Totally.
So you want to look at the non-surgical ways of helping people as well. And one of them is hormonal contraception.
To get rid of your fibroids?
So actually, it actually minimizes fibroid exacerbation. So with patients who have been, we know that women who have been on hormonal contraception for 10 years or greater have lower risk of fibroid issues.
Interesting.
And sometimes it also prevents bleeding. So remember I said it can make the environment inhospitable to implantation. When it's fluffy and lush inside of the uterus, it's great for the embryo to implant. If it's inhospitable to that with a progesterone effect, then it also decreases bleeding flow. So we can improve anemia in women with fibroids. In women who have lots of infrequent and difficult to know when the periods are coming, so sometimes perimenopausally, for example. I remember my aunt, I'm going to get in trouble for saying, I won't say her name on television, but she called me when I was training as a gynecologist, and she's like, Marge, I'm bleeding sometimes 3 times a month, or then I don't bleed for 3 months, and then the floodgates open, I can't wear white pants. And I'm like, oh, so do you have a history of liver disease? And she's like, why are you asking that? Do you have clotting disorders? She says, no. I said, why don't you talk to your doctor about being put on the birth control pill? She's like, I'm not having sex. And I said, no, that's not the point. The point of that is to make your periods regular and predictable, and also to decrease the bleeding flow. And she said it revolutionized her life. She still talks about it today, and she's way postmenopausal now. So you can improve someone's quality of life by thinking outside of the box with the hormonal contraceptive tablet.
Also, the birth control pill, does it help skin sometimes?
Yes. So when patients have polycystic ovarian syndrome, or usually just sometimes even vanity, because the estrogen does something, increases something called sex hormone binding globulin, which is in English is a protein that circulates, and it can bind to the male hormones that cause the acne in the hair. So when you do that, you take the birth control pill, it binds to the circulating androgens so they don't make acne and you don't get hair. It's really cool. And that even some of the progesterone, because there are different kinds of pills and different kinds of progesterone and estrogen components, some of the progesterones are specifically anti-androgenic. So you'll pick a specific formulation based on its ability to decrease acne.
What about risks, though? Are there any risks, like to the pill? The pill's been around for a very long time, but if you're on it for too long and you go off, can you get pregnant right away?
It depends on which hormonal contraception you were using. So the injectable one has a longer time to return to fertility. The pills, sometimes you can rebound ovulate 2 pills at a time. And if you're on the pill long term, you can decrease your risk of ovarian cancer even, because you don't ovulate as much. Just like if you're pregnant, you have people who've had babies have lower risks of ovarian cancer.
Any other risks that we should know about, though, from taking any of these contraceptives? Well,
there are clotting risks, and sometimes you have medical contraindications to taking hormones at all. So you need to talk to your physician about it and weigh the benefits and risks, but it's not all the same in every single person. So you really have to talk to your healthcare provider. Okay, that was good. That was a mouthful. I know, but you've got it. You're so good. It's in there. Thank you, Marjorie.